Although it is rare, good pasture syndrome is deadly. Compassionate care, early diagnosis, and immediate therapy are crucial. Get help if you have respiratory symptoms you can't explain or blood in your urine. Good pasture. Before his lungs began to bleed, he was in good health. His kidneys are being attacked by an unexplained disease. Is his immune system at blame for this? We examine the horrifying reality of good pasture syndrome tonight on Scientific Secrets. Anti-GBM illness, another name for good pasture syndrome, is an uncommon autoimmune condition where the immune system creates antibodies that target the kidney-lung basement membranes of the body. The targeted victim, one important structural element of the glomeruli and alveoli, is type 4 collagen. The antibodies cause tissue destruction and inflammation as soon as they attach to the basement membrane.
Hello, doctor.
Hi.
Okay. So, you diagnosed me with, what was it, good pasture syndrome?
Yep.
So, what is that, like, what are the early signs that?
Urine, a pattern first recognized by the pathologist Dr. Ernest Goodpasture. To understand Goodpasture syndrome, let's start by thinking about the basement membrane, which is a thin, sheet-like layer of tissue made of protein that keeps the epithelium stuck firmly to the actual organ, kind of like double-sided tape, which keeps wrapping paper stuck to the gift. This basement membrane is made up of various proteins, but the major one is collagen. And since basement membrane exists throughout every organ system, it's no wonder that collagen is the most abundant protein in the human body. As far as proteins go, collagen's a pretty sweet-looking one, with a triple helix structure composed of 3 separate chains that are intertwined like braided hair. Each of the chains can be one of 6 types, named alpha 1 through alpha 6, and the most common form of collagen found in the basement membrane is collagen type 4, which is made by mixing and matching these 6 alpha chains. One version of type 4 collagen combines the alpha 3, alpha 4, and alpha 5 chains. Another combines 2 alpha 1s and an alpha 2. And a third version has 2 alpha 5s and an alpha 6. And this list of combinations goes on. So it turns out that the alpha 3, alpha 4, alpha 5 variant is most common in the glomerular basement membranes of the kidneys and the alveolar basement membrane of the lungs. In Goodpasture syndrome, autoantibodies bind to a specific part of the alpha 3 chain that's usually hidden deep within the folded chains. This is an example of a type 2 hypersensitivity reaction, because once these autoantibodies, usually IgG but rarely IgM or IgA, bind to the alpha 3 chain, they activate the complement system. Now, the complement system is a series of small proteins present in the blood.
One of the early symptoms are an acute cold, fatigue, cough, but they quickly increase.
Oh, okay. I also did some researching on it then. I saw that it can like affect my kidneys. So
Yeah.
how are my kidneys at the moment then when you did those tests?
It becomes risky at that point, but kidney function may start to decline in the matter of days. You'll start to notice dark and red urine, decreased urine production, edema, and raised blood pressure.
Yeah, with my cough, I thought at first it was only something like bronchitis, but it wasn't until there was some blood in my urine that I noticed that my kidneys were failing. So then
Yeah,
Now that's the thing with like good pastures.
good pasture syndrome, yeah.
Okay. In the lungs, pulmonary bleeding results from the immune system attacking the capillary membranes, which allows blood to leak into the alveoli. This could jeopardize your life. When the collagen in the tiny blood vessels get damaged, it leads to serious problems. In the kidneys, you might see blood in the urine, dark colored pee, swelling in the legs and feet, and rising blood pressures. In the lungs, you might experience coughing of blood, shortness of breath, and chest pain.
The glomeruli, which are essential for waste filtering, became inflamed and damaged. Blood and protein leak into the urine. Kidney failure and irreversible damage result from this if left untreated. Dialysis or even kidney transplants are necessary for many patients. Quick recognition and action are essential.
If good pasture syndrome isn't caught in time, it could cause permanent kidney damage and even life-threatening bleeding in the lungs. That's why early treatment is so important. Doctors use a few different tools to confirm the diagnosis. First, they'll do a blood test to look for any GBM antibodies. These are the troublemakers, targeting the collagen layer. Then they'll check the urine for signs of blood and protein. And they might order imaging tests like a chest x-ray or a CT scan if the lungs are involved. Okay, knock, knock, knock. Hi, I'm Sarah, I'll be your student nurse today. We're just going to be doing a short head-to-toe assessment on you. Can I get your name and date of birth?
Jeremy De La Cruz, September 10, 2004.
Sounds good. We'll be doing a short assessment on you from head to toe. I'm just going to be looking if you have it. I'm just going to be listening to your lung sounds.
Okay.
Okay, I notice crackles that are present, and then I'm seeing a low O2 stat that is about 80%. So we'll put you on some oxygen. And were you experiencing any blood in your cough?
Yeah, I had a little bit.
Okay, and do you know how long that lasted for?
It's been like a week about.
Okay, now I'm just going to look at your extremities. I see your legs are a bit swollen. There's a lot of fluid retaining there. Kind of looks like edema, if I could say. Did you have any urine output changes by chance?
Yeah, there is a little bit of blood in my urine now, and I have gone a little bit more frequent than usual.
Okay, we're gonna try to look more into that by getting a urine sample. And did you have any symptoms of like too much fluid, or we're just looking for symptoms of fluid overload?
I mean, yeah, there was the swelling in my legs that I noticed.
Okay, and did you feel any pain anywhere else or any other like leg edema by chance?
Nah, not real.
Okay, and do you know what's today's date?
I think today is Wednesday.
And do you know what you ate for breakfast by chance?
Oh, that was just like a bowl of cereal.
Sounds good. I was just checking for any uremia related confusion. But thank you so much. We're going to help you figure this out. And yeah, I'll be back with more details.
Hi, everyone. Today we're talking about an important but rare disease, good Pastures syndrome. In this condition, the immune system gets confused, and instead of protecting your body, it attacks vital collagen inside your kidneys and lungs. Although it is rare, good Pastures syndrome is deadly. Compassionate care, early diagnosis, and immediate therapy are crucial. Get help if you have respiratory symptoms you can't explain or blood in your urine.